I have the pleasure of introducing Moving Analytics next. Moving Analytics was introduced to us by way of Stanford University. Dr. Robbins and I had the pleasure of being on the interview call with Ade Adesanya, who's the Chief Operating Officer of Moving Analytics. And immediately we were captured by his enthusiasm for what he's about to accomplish. Moving Analytics establishes a very convenient mobile platform for cardiac rehab. As an ER physician, I see a lot of patients in the emergency rooms every day that could be outside of ER, be treated by the primary care doctors, and we can prevent significant number of readmissions if patients with cardiac conditions, coronary artery disease, congestive heart failure, follow cardiac rehab programs. International guidelines recommend cardiac rehab for this patient population. However, the usage and access to cardiac rehab programs are suboptimal. Less than 50% of patients who can benefit from such programs actually get to have access to them. So this mobile platform is enabling better access, more convenient access, and an affordable way for patients with cardiac conditions to stay out of the hospital. With that, I'm pleased to introduce Ade Adesanya.
Thank you. Well, good afternoon, everyone. Thank you so much for taking out the time to join us. I hope you've been excited by all the presentations before. My name is Ade Adesanya. I am the co-founder of Moving Analytics, and I would like to talk to you about the work we're doing in chronic disease management. So I'd like to tell you a story of Joe. Joe just suffered from a heart attack. After his discharge, his cardiologist prescribed him a cardiac rehab program and emphasizes that it's important for him to finish it because patients who do live 5 years longer and have half the risk of getting readmitted. But for Joe to participate in the program, he would have to go to the hospital 36 times, and usually the hospital is very far away from home and work, and also the classes are only offered during business hours. In addition, the program costs up to $1,800 in copays. Unfortunately, Joe decides not to enroll in the program. But Joe is not alone. In fact, less than 20% of patients in the US will ever attend cardiac rehab after surgery. And because very few patients do rehab, most rehab centers are unprofitable and hospitals are penalized because of readmission penalties. But there's an alternative. At Moving Analytics, we help hospitals implement a convenient and affordable cardiac rehab program that is delivered through patients' mobile devices. Our platform was developed in partnership with Stanford. So let me show you how it works and tell you a different story for Joe. So once Joe is discharged from the hospital, his nurse care manager will create a care plan for him on our dashboard. This plan is sent to Joe through an app on his smartphone. At home, the app guides Joe through his rehab tasks, which includes his exercise prescription, tracking his different vital signs, education, and an easy-to-use interface for him to communicate with the nurse. As Joe completes his daily rehab tasks, his progress is sent back to the dashboard. Once a week, his nurse calls him to check in on him and his progress, address any challenges he has, and revises his goal for the following week. Using our software, we make cardiac rehab more convenient and affordable for Joe. He only goes to the hospital 12 times now, and the program only costs $600. And in our deployment across 500 patients, we've shown that 90% of patients who do the program actually finish it. That's compared to 5% before. So with this, we can help hospitals see 3 times more patients, we can help them increase revenue, and we can help them reduce readmissions, which is very important. Medicare reimburses the hospital $1,500 per patient who does the program, and we charge the hospital $300. So it's a software license business model. And with 3.5 million patients each year in the US who are eligible for cardiac rehab, this represents $1 billion market opportunity. And we're well on our way to capturing that market. In less than a year of operations, we signed 10 of the leading cardiovascular practices in the country. But our secret sauce is really our team. Our team includes experts in chronic disease management from Stanford, software development, and business and sales. Since joining TMCx, we've had a fantastic time. We've raised $1.2 million in seed funding, and we're currently engaging 40 hospitals that we hope to close by the end of the year. I want to end on a note on why this is important to me. Patients who do cardiac rehab live 5 years longer. I want you to ask yourself, what does 5 years mean to you? How many more birthdays, how many more anniversaries, how many more opportunities to say, I love you? At Moving Analytics, this is what we're fighting for, to make healthcare more convenient and more affordable so that patients with chronic diseases can live a healthier, happier, more productive life. If you would like to join us in our cause, I would love to talk to you. I'll be standing there in my smashing pink jacket. Thank you very much. I'm Ade from Moving Analytics.